Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Lorie Roffelsen. Lorie Roffelsen is a registered dietitian at the Washington Hospital Healthcare System. Lorie completed her studies at San Francisco State University. She is a prominent speaker for Washington Hospital's community outreach educational programs.
And we'll talk now a little bit about HeartHealthy Diet and strategies for controlling blood pressure with dietary and lifestyle changes. You hear the term heart-healthy diet a lot. So what constitutes a healthy or heart-healthy diet and living? Think about it as it can be a lot of little things, meaning all the choices we make every day, like choosing low-fat milk when we're at the coffee shop instead of whole milk, walking the stairs at work when we have an opportunity instead of taking the elevator. And it can be some big things, which will definitely have more of an impact on our heart, such as quitting smoking, giving up that daily donut at breakfast and maybe substituting oatmeal or something more heart healthy. Even losing a small amount of weight, 10 to 15 pounds, can have a significant improvement on your heart health. So it can be a lot of little things and big things, but these all can add up over a lifetime to help promote healthy aging as we get older. Heart disease is the leading cause of death for both men and women in the United States. And in 2008, say that heart disease caused about 25% of deaths. So almost 1 in every 4, and about half of those were among men. But some other good facts to note is that for people without heart disease, lowering cholesterol and blood pressure levels can reduce the risk for developing heart disease. And for people who have heart disease, studies have shown that lowering cholesterol and blood pressure and controlling those numbers can reduce the risk of dying from heart disease, having a non-fatal heart attack, needing bypass surgery or angioplasty. So now I want to talk about what are some of the dietary and lifestyle influences on heart disease risk. So there's some things we can't control, like our genetics, our gender, our age. Those are also risk factors for heart disease. But there are some areas that we can look at and see how we can modify them. So we know high blood pressure can be influenced by a high sodium diet. So we're going to talk about that quite a bit today. A high intake of unhealthy fats. So we're going to point out today what are considered unhealthy fats for the heart. And that's primarily saturated fats and trans fats. High intake of dietary cholesterol, oxidative stress, being overweight, having a lack of exercise and activity, or having uncontrolled or poorly controlled diabetes. So these are all influences, and these are areas that we can have some control or some influence on. What a lot of studies have shown, though, regarding sodium's effect on blood pressure is that as sodium intake increases, blood pressure increases. And among countries who have higher intake of sodium, they have higher rates of high blood pressure. And conversely, with consistent decreases in sodium intake, you can decrease blood pressure. So let's talk about sodium in the diet. It is an essential nutrient in your body. It has functions, but the amount that is in the typical American diet is much much, much higher than the amount that the body needs for those functions. Primarily, we consume sodium in the form of salt or sodium chloride. But you will see, if you pay attention to ingredient labels, you will see lots of different forms of sodium in packaged and processed foods. And they use sodium as a preservative, as a flavor enhancer. It's used in baking. So it has a lot of functions in processed foods. So it's important to note that 75% of the sodium in the American diet does come from processed packaged foods, not from the cooking that we're doing usually at home. Now, of course, if you're using a lot of salt in cooking or a lot of certain types of sauces like fish sauce, soy sauce, oyster sauce, those are very high sodium, and so that will contribute a lot as well. But for the most part, that little salt that you might add at the table or in cooking provides a small amount in relation to the other sources of sodium in the diet. So what are sodium intake recommendations? So the average American consumes about 3,500 milligrams of sodium. And of course, there are those of us that consume a lot more than that. There's some recommendations that have come down in the last, with the 2010 Dietary Guidelines for America, suggesting try to reduce to less than 2,300 milligrams sodium per day. And they base those on studies showing improvements in blood pressure based on those intakes of sodium. And for special populations, they suggest try to reduce even further to about 1,500 milligrams a day, which is pretty stringent. And that's for people who are older than 51, if you're African American, or if you already have hypertension, diabetes, or chronic kidney disease. So let's talk about some of the strategies that you can try to incorporate to help you control your blood pressure. So we know regular exercise and activity is helpful for lowering blood pressure. So the recommendation for adults is to aim for about 150 minutes per week. So that's 2 hours and 30 minutes, and you can break it up any way that fits into your schedule. And they're talking about moderate intensity exercise, brisk walking, swimming, dancing, bicycling. And you certainly can do more than that if you're able to, but try to aim for that minimum of 150 minutes. It's important to try to maintain a healthy weight as we age, or lose weight if we're overweight. And so if you're looking for ways to help control your blood pressure with and minimize medication that is needed, you can first try those strategies. Limiting alcohol consumption, like Dr. Sagal talked about, and also reducing sodium intake. So what you can do to reduce your sodium intake is, of course, since I said about 75% of the sodium in our diet comes from processed foods, you want to look at that area and see how much processed food and eating out are you doing, because those are places you can definitely reduce sodium. So if you're eating cured meats, canned vegetables, canned soups, frozen foods, anything that's packaged and processed, check the label to see what is the sodium content in those foods. Fortunately, there are more options for people who like, say, canned vegetables or rely on some of these convenience foods. And so manufacturers are responding to actually government mandates to reduce sodium in processed foods, since they're so widely used by the public. So you might also see a difference between different manufacturers. So if you're looking for a cracker to buy, compare the sodium in the different brands that are out there. You might see a significant difference in sodium among manufacturers. You can also reduce salt that you use in cooking. And that includes not just salts, but also sauces, which can contribute a lot of sodium. And over time, and I tell this to patients a lot, your taste buds do adjust to less sodium or less salt in your cooking, but you have to be patient and give yourself some time to adjust to that. And if you're one that eats out a lot, you want to try to follow these habits when you're eating out, which means maybe asking how the food is prepared, getting sauces or dressings or gravies on the side so that you can control how much you're going to eat. Now I'm going to talk a little bit about the DASH diet, and DASH is an acronym for Dietary Approaches to Stop Hypertension. And recently, U.S. World and News Report voted the DASH diet as the best diet out there, ranked, they looked at the Mediterranean diets and different weight loss diets, and they said the DASH diet is the best because it's very balanced, it's, the foods are not kind of strange foods you have to search for, they're just fruits, vegetables, things that you'll find at your grocery store, and you can actually lose weight on the DASH diet. So when we kind of look at what you eat when you're following the DASH diet, you can kind of see why. It does eliminate a lot of processed foods. So the emphasis on the DASH diet is food sources that are rich in potassium, calcium, and magnesium. So one of the questions Dr. Sagal had was about sodium and why does sodium raise blood pressure? And one of the reasons they believe it can raise blood pressure is when you're eating a high sodium diet, your body may retain water or fluid to try to balance the sodium level that is in the bloodstream, and that can increase your blood pressure. These minerals, potassium, calcium, and magnesium, can actually help enhance excretion of sodium from the kidneys, so that thereby lowering the sodium in your bloodstream and your blood pressure. So the DASH diet was a study done by the NIH, and it was conducted at 4 different centers in the United States. They gave participants in the study specific meal plans, and they all showed improvement in their blood pressure. Some were given the 2,300 milligram level of sodium to follow. Others followed the 1,500 milligram sodium level, and they had even better improvements in their blood pressure. And there were improvements in blood pressure within 2 weeks of following the DASH diet. So almost immediate, they showed a difference by following the plan. So it encourages, again, sources of potassium, calcium, and magnesium. It encourages whole grains. So there's a lot of vegetables, fruits, and fat-free or low-fat dairy products, since those are good sources of calcium. And also nuts, seeds, and legumes, which are good sources of potassium and magnesium. And at the same time, it's overall heart healthy, saying, limit your intake of fat, sodium, and sweets and added sugars. So this slide just shows you the nutrient goals that they used in this study. And on your left shows you the fat goals, the cholesterol goals, which are generally the heart healthy guidelines that other heart healthy diets like the Mediterranean diet or the TLC diet, which I'm going to talk about a little bit later, they also encourage about those levels of intake. This diet's a little different because it also encourages the foods that are good sources of potassium, calcium, and magnesium. So it has specific goals to try to reach for potassium, for example, which is about 4,700 milligrams. So to get to that level, you have to eat a lot of fruits and vegetables, and the ones that are high potassium. It also encourages a lot of fiber. So if you're able to actually eat everything on this meal plan, you're going to be pretty full. You probably won't be eating a lot of extra foods or foods that are, you won't have much probably room to eat other things. So the range of servings per day from each food group is listed here. So grains, about 6 to 8 servings a day. Vegetables, 4 to 5 servings a day. Fruits, 4 to 5. You probably would eat the higher end of that range if you're a man or if you're a younger person or very active. And for women, we would probably be eating more the lower end of that range. So just to stay in our calorie limits. And again, it recommends limiting sweets and added sugars. And that's just to kind of limit calories as well. So the servings they're talking about for grains, One serving of grain would be like 1 slice of bread or 1 ounce of cereal or a half cup of cooked pasta or rice. For vegetables, it would be like 1 cup of raw vegetable or a half cup cooked. Fruit, they're talking about like 1 medium orange or 1 medium banana, a 1/4 cup of dried fruit, or a half cup of fresh, or a half cup of juice. Milk and dairy group, they're talking about like 1 serving would be a cup of milk or a cup of yogurt or 1.5 ounces of cheese. And they emphasize choosing low fat or reduced fat milk and dairy. Limiting meats, when you have meats, of course choose lean meats and no more than 6 ounces per day. Nuts, seeds, and legumes are beans, peas, and lentils, a half cup cooked, or 2 tablespoons of seeds, or 2 tablespoons of peanut butter. So there are some small servings for like the seeds and the peanut butter because they are high in calorie. They are healthy types of fats, but you still want to eat them in small amounts. And then small amounts of fats and oils, teaspoon of margarine, teaspoon of oil, and small amounts of any added sugars. So starting with breakfast, I have a low-fat granola bar, medium banana, half a cup of yogurt, a cup of orange juice, and a cup of low-fat milk. So you can see this, the main sodium here is from the granola bar, which is a packaged processed food, and the milk. And so dairy products naturally have a fair amount of sodium. Then at lunch, it's a turkey breast sandwich. Now you'll see the sodium in that turkey breast is very low because they're suggesting buying a turkey breast and cooking it yourself, marinating it and controlling the sodium versus buying turkey lunch meat. Unless you can find like a low sodium turkey, you could do that as well. And then the main sodium at this lunch meal is from your condiments and from the bread. But they don't suggest you have to use low sodium bread to stay within a low sodium diet. Just kind of looking at the other things is important too. So we've got a couple servings of vegetables here. So you've got the lettuce and tomato on the sandwich, and you also have a side of broccoli, and then you have an orange. And then at dinner, it's 3 ounces of baked fish. The scallion rice is a brown rice. And then at dinner, there's 2 vegetables, spinach and carrots, a whole wheat roll, so there's your whole grain, and a little bit of margarine for fat, and 1 small cookie. That's your sweet for the day. And then 1 snack, which you could have anywhere, either between meals or at night. And that provides almonds, milk, and some dried fruit. So if you were to eat all of that food, it's about 1672 milligrams of sodium per day. This is one of the lower days, because they did have 7 days of meal plans, so some were closer to 2,300 milligrams. So it just depends what you're choosing. So for example, if you use a box cereal like Cheerios, there's a little bit more sodium in that than there would be in the granola bar that we had today. So it's very doable, but there's no real added salt here in the cooking. There's some sodium that's in the breads and the dairy, but there is it's a lot of fruits and vegetables and grains. So that's kind of the basics of the DASH diet. Now I'm going to talk also about other factors that may increase risk for heart disease besides high sodium or hypertension. Pro-inflammatory foods are looked at because it's believed that there's some foods that can increase inflammation in the body, and inflammation is believed to be something that can encourage the progression of heart disease. And so it's a good idea to try to limit these types of foods. Foods that have refined sugars are believed to increase inflammation. So candies, pastries, sugar-sweetened beverages, highly processed carbohydrates like donuts and potato chips, certain types of oils, hydrogenated oils or partially hydrogenated oils, processed meats, and saturated fats. So foods that are believed to be anti-inflammatory or have the effect of lowering inflammation in the body would include Foods from the plant kingdom like beans, legumes, tofu, green tea and red wine. Fish like cod, halibut, herring, oysters. Fruits like apple, berries, all the berries, cherries, citrus, pineapple, tomatoes. Certain herbs, basil, cinnamon, ginger, mint, oregano, thyme. Nuts, oils like canola and extra virgin olive oil. Dark chocolate. And these vegetables listed: bell peppers, broccoli, cabbage, garlic, greens like spinach and kale, onions, and sweet potatoes. So these are anti-inflammatory foods. So try to include these more and less of the pro-inflammatory foods. Recently, now we've always talked about low-fat diets and lowering cholesterol, but researchers have looked more now at also the impact of added sugars to increase risk for heart disease. And so there's less of an emphasis on a low-fat diet versus eating healthy types of fats, but definitely limiting our intake of added sugars. So by added sugars, I mean sugars that are in sweetened drinks like sodas, Gatorade, those types of drinks, sugars that are in candies, jellies, jams, pastries, cookies, things like that. What studies have shown is that added sugars increase blood pressure, they increase triglyceride levels, they can increase your fasting glucose, they decrease insulin sensitivity, they can over time increase abdominal fat weight gain. And so those are all characteristics of what we call the metabolic syndrome, which if you have any or all of those factors, it can really increase your risk for heart disease. And they're also believed to increase inflammation and oxidative stress in the body. So oxidative stress is, if you think about a bicycle and it's out in the rain and it will rust, that's oxidation, right? So the body is constantly under the same type of what we call oxidative stress. And there's potential for something called free radicals to form in the bloodstream, which can over time, and free radicals can damage or oxidize our LDL cholesterol. So oxidative stress can lead to inflammation. It can lead to damage in the arteries of our vascular system. So we want to minimize oxidative stress. Things that can reduce it is, and actually I think I have a slide coming up talking about that a little bit, but eating antioxidants, eating fruits and vegetables, foods that kind of combat oxidative stress is one thing we can do. Exercise also can combat that. So there's actually recommendations from the American Heart Association about limiting added sugars in the diet. And they believe there's enough evidence now to make these recommendations. So for women, it's recommended limiting your added sugars per day to no more than 5 teaspoons. That equals about 80 calories. And for men, they can have a little bit more, I think, again, because of body weight and size. And so they're recommended no more than 9 teaspoons per day. And just as a reference, one 12-ounce can of cola has 8 teaspoons of sugar. So the American diet has, we've really increased our intake of added sugars over the years. We generally eat more food than we used to eat. That's part of it. And so there's just more food, more calories, more things that have added sugars in them. Food labels don't always give you exact amount of added sugar. So just looking at the nutrient label, you don't know how much of that is added sugar, how much is natural sugar that occurs in that food. So they're actually, hopefully the food labels become a little bit more informative if they're ever revised and give us an indication how much is added sugar and how much is natural sugar. Okay, now let's talk about cholesterol. So cholesterol, it's a wax-like substance that the liver makes. It has a lot of functions in the body. It's found in cell membrane structure. It's needed to make bile acids and hormones and steroids. It's needed to make the active form of vitamin D. and it insulates nerve cells. But our liver does make cholesterol, so dietary cholesterol is really not necessary. So if we eat a lot of dietary cholesterol and there's excess circulating cholesterol in the bloodstream, it can sometimes get into trouble and contribute to heart disease. So what can influence our cholesterol levels? Well, diet, weight, and physical activity have an influence. Of course, our genetics do as well. That's not really an area we can control, though. And our age, age and gender, so typically you might see increases in cholesterol in men before we see them in women. Sometimes women, when we hit menopause, we will have increases in our cholesterol levels. Now we have your total cholesterol number, like Dr. Sego was talking about, and then we have different fractions of that total cholesterol. And HDL, or we call it the healthy cholesterol, is a number we want to keep as high as possible. HDL transports cholesterol away from the heart, and so it's a carrier protein. And a desirable level for your HDL cholesterol is at least above 60 milligrams per deciliter. When we have low HDL numbers, it's sometimes attributed to smoking, obesity, inactivity, trans fat intake, that's why trans fats are banned now, and high triglyceride levels. So often when our triglycerides are high, they depress our HDL number. Now LDL cholesterol, or we call that I think Dr. Sagal called it the bad cholesterol, or I call it the lousy cholesterol. This number is really the target of therapy when we're trying to lower our cholesterol numbers. It's not just total cholesterol. We want to lower that LDL number and keep it as low as possible. LDL carries cholesterol towards the heart and its arteries, and it is easily oxidized and can contribute to plaque formations in the arteries. So HDL, we don't worry so much it's going to contribute to plaques, but we know that LDL does. And so these are some of the factors that can oxidize your LDL cholesterol: smoking, diabetes, low antioxidant intake, low HDL if you have hypertension or high triglycerides. So those are all things to try to control to prevent that LDL oxidation. Now there are certain foods that we know raise LDL cholesterol levels. And so these are the foods we want to target in the diet and try to reduce or eliminate. So sources of saturated fat, trans fat, and dietary cholesterol can all raise the LDL cholesterol levels. Saturated fat is found in both animal foods and plant foods. In animal foods, you're going to find more saturated fat in fatty cuts of meat, solid fats like butter and lard. Seafood has a small amount compared to meats. And if you eat whole fat dairy products or whole milk, there's a lot more saturated fat in those types of dairy products compared to fat-free or low fat. So we always recommend try to switch to fat-free or low-fat dairy. And then in plant foods, you'll find saturated fat in coconut and coconut oil, palm oil, and palm kernel oil. So they'll use palm oil, and palm kernel oil is used a lot in processed foods. You'll see it in crackers and cookies. So look for, if you see a food has saturated fat, you can go to the ingredient label and see what is the source of the saturated fat. Sometimes it's butter, sometimes it's palm oil, palm kernel oil. Try to find a version of that food that maybe is made with a liquid oil instead of one of those saturated fats. Now, tip to avoid trans fats. We're trying to eliminate them from the American diet, but you'll still see sometimes partially hydrogenated oil on some labels in small amounts. They might still be in food. But depending on how much you eat of that food, it can still add up to an amount that's more than the recommended daily amount. So always look at food labels. Limit or avoid eating out fried foods because they might be using a solid shortening that has hydrogenated oil in it. When you're home, use natural, unhydrogenated liquid oils for cooking, such as olive oil, canola oil, And choose foods as much as possible that are made with liquid oils and try to avoid those hydrogenated oils and saturated fats. And then if you use margarine for foods, choose the soft tub margarines that have as their first ingredient liquid oil or water versus using a hard stick margarine. Now, cholesterol food sources. We want to limit cholesterol from foods that we eat. Just always remember cholesterol is only found in foods of animal origin. So if it had a mom, had eyes, it has some cholesterol in it. Foods that are very high in cholesterol would include egg yolks. So if you have high cholesterol or if you have heart disease, you should be limiting your eggs to no more than 2 per week. Organ meats are very high. And just always remember there's no cholesterol in foods that are plants, vegetables, fruits, beans, and grains. So they have calories, they may have fiber, carbohydrate, but they don't have cholesterol. And recommendations now as far as fat intake do not advocate a low-fat or fat-free diet. There has to be a good balance between fat and carbohydrate and protein. But you want to think about quality of the fats that you're including in the diet. So eat the healthiest kinds of fats for your heart and add them in an amount that is going to help you maintain your weight goals, whether it's weight loss or weight maintenance. So what makes good fats good? Well, the monounsaturated fats, we know from studies, do not raise our LDL cholesterol level. And so monounsaturated fats, to give you an example, would be like canola oil, olive oil, avocado. Those are monounsaturated. And they don't hurt our HDL. Polyunsaturated fats, again, do not raise LDL cholesterol. Some studies suggest a high intake of polyunsaturated fats might hurt your HDL, but there's not really probably enough evidence to say avoid those polyunsaturated fats. So in the category of polyunsaturated would be our omega-3 fats, which have been shown to decrease inflammation in the body and risk for sudden death and heart arrhythmias. So you can get your omega-3 fats from both fish sources and from vegetable sources. Although they're a different type of the omega-3 fat, they both have heart benefits. So if you eat fish, listed here are some of the fish that are higher in omega-3 fats. So they're fatty, oily types of fish. And then in the plant kingdom, you can get the alpha-linolenic acid type of omega-3 fat from green leafy vegetables, from flaxseed, canola and rapeseed oil, soybeans, and also soybean oil, walnuts, and wheat germ oil. So those are all, and flaxseed again is the best source. And the American Heart Association, because they see the benefits of omega-3 fats, they do have recommendations for the general public to try to include at least 2 fish meals per week to get those omega-3 fats naturally, and eat a variety of fish to kind of spread your risk, knowing that some fish there's risk for contaminants, et cetera, that are in the environment. And also eat your plant sources of the omega-3s. If you have documented heart disease, the recommendation is to try to have at least 1 gram a day of the EPA and DHA per day, preferably from oily fish, but if you can't eat that much fish, then check with your doctor about maybe supplements. And there is treatment for high triglycerides by taking larger doses of the omega-3 fats, and that would be under physician's care. But that's been shown to be pretty helpful in lowering triglycerides. Now another diet, and this is from the National Cholesterol Education Program, is called a TLC diet. And that stands for Therapeutic Lifestyle Changes. So it's not just a focus on diet, but also on exercise and weight management. So if you follow the TLC diet, it's kind of similar to the DASH diet, but the amount of meat or fish or animal protein per day is 5 ounces or less. So it's very small amounts of protein from from the animal, from sources that have cholesterol, basically. 2 to 3 servings of dairy, so that's similar to the DASH diet. No more than 2 or fewer eggs or egg yolks per week. Now you could have like egg whites every day, since those don't have cholesterol in them. Small amounts of fats and oils that are, again, in the heart-healthy category of fats. Whole grains, 6 or more. Again, so these ranges are very similar, again, to what's on the DASH diet. Looking at the TLC diet, even choosing just one change that's recommended, you can see you can reduce your LDL level. So for example, by adding soluble fiber, people could see a change of 3 to 5% in their LDL. So if you are already doing some of these things and you're hoping to lower or improve your LDL number a little bit more, you can see if there's another area where you could maybe make a change, such as maybe lose a little bit of weight or decrease your cholesterol intake a little bit more. One of the recommendations for adding soluble fiber is because soluble fiber in foods acts kind of like a sponge in the gut. It helps to bind the dietary cholesterol that's there. So rather than us absorbing it and increasing our blood cholesterol levels, it's excreted. So there's some good food sources of soluble fiber. You can get it from barley, oats, psyllium, ground flaxseed, fruits like apples, berries, pears, citrus, bananas, nectarines, peaches, so some of the stone fruit we don't have right now. So kind of what's in season, try to grab out there at the grocery store. Brussels sprouts, broccoli, carrots, dry beans, peas, soy products. These are all good sources of soluble fiber. Another TLC addition you can make is making sure you have plant sterols or plant stanols in your diet. Now these naturally occur in foods, and you might see in the grocery store they're added to certain products to promote their heart healthy or cholesterol lowering effect. The way they work, they are similar in structure to cholesterol. So in the gut, they compete for absorption with any dietary cholesterol that's there. So basically the body will absorb the plant sterols and it will not absorb the dietary cholesterol that's there. So they kind of naturally help lower your cholesterol level. So they can lower your LDL cholesterol and they don't hurt your HDL cholesterol. Now the National Cholesterol Education Program says there's a therapeutic amount of these plant sterols that you could try to add on a daily basis. And they see cholesterol lowering with about 2,000 milligrams per day. Now the amount you can get from eating foods that are sources of plant sterols is not going to get you to that therapeutic level. So you have to definitely try to include these food sources, legumes, nuts, seeds, vegetable oils listed there, peanut and olive and soybean. But you may have to add fortified foods to get to that 2,000 milligrams a day. So some of those special margarines like Benecol, Take Control, those have these plant stanols or plant sterols added. Also, I've seen them added in orange juice, in yogurts, and different products. Now I wanted to give you some guidelines for heart-healthy shopping. So I said earlier, always read labels and compare products. Try to choose foods in general that do not have a lot of ingredients, especially if they have a lot of salt or sugar or fats added. For sodium intake, try to, just a general rule of thumb, choose products that have less than 300 milligrams sodium per serving. It's considered low sodium if it's less than 140 milligrams per serving, but 300 is, a reasonable number if you're, looking at products. And if you're trying to fill up on fiber, choose cereals that have at least 5 grams fiber per serving and breads that have at least 2 grams fiber per serving. Okay, just to kind of summarize American Heart Association diet and lifestyle recommendations for cardiovascular disease risk reduction. Balance your calorie intake and physical activity to achieve and maintain a healthy body weight. Try to consume a diet that's rich in vegetables and fruits. Choose whole grain, high fiber foods. Try to consume fish at least twice a week. Limit your intake of foods that are sources of saturated fat and trans fat. Limit your dietary cholesterol to 300 milligrams per day or 200 milligrams per day for individuals who have heart disease. Minimize your intake of foods and beverages that have added sugars. Try to choose foods that are prepared with little or no salt. If you consume alcohol, do so in moderation. So for women, that's no more than 1 drink per day, and for men, no more than 2 drinks per day. And when you eat outside the home, try to follow these American Heart Association guidelines in your eating out as well. And then I wanted to give you a few sources on the internet for more information. The American Heart Association has a lot of shopping, cooking, meal planning tips, recipes. It's a really good source if you want more specific information. And the National Heart, Lung, and Blood Institute has information on the DASH diet, as well as like a 7-day menu and meal plan. And then there's the American Dietetic and American Diabetes Association websites as well.
Thank you very much for being here today, Lorie.
Thank you.